I go about once a year. If I get off my medications, I have to go back to the hospital and get reestablished on my medications.
I said I'm not ready to get out on my own because at that point I wasn't medically stable.
So typically, we see people on average that have gone to the hospital in the last 90 days 7 times. Our requirement is about 3 to 6 times, and on average we're seeing it about 7 times. We have people that have gone 30 plus times in the last 2 weeks. So we really are targeting the most vulnerable, the people that are using the most highest cost resources in our in our local area, which are the hospitals, the ambulances, a lot of police contact, and they just never get connected to that outpatient care.
We were funded to do some unique things in Missouri to help reach out to individuals with behavioral health disorders. One of those was to help look at the emergency rooms. Emergency rooms were being inundated with individuals with behavioral health disorders. Those could be people with severe mental illness, those could be people with addictions, but it was mostly people that didn't really belong there. That was not the place to get the best care.
Many times people in behavioral health distress are taken to the emergency room by family members, friends, law enforcement, where they're stabilized and released without the needed follow-up care. This program is designed to identify those individuals and get them connected to a community mental health center where they learn coping skills and how to manage their symptoms and what they should do in the future if they're in behavioral distress rather than go to the emergency room.
Because there's a lot of people like me that have like mental issues, and there's a lot of backups at the ER. They need to be addressed, and like the people in mental conditions are treated a lot different than the other people.
Well, generally emergency rooms don't have psychiatric professionals or behavioral health professionals on staff. They're not equipped to deal quickly with folks who come in, let's say, dealing with symptoms of schizophrenia. They have to call down a psych consult. That may take a long time. Individuals who maybe have active symptoms are harder to manage and might be disturbing to other individuals in the emergency room. They don't have bleeding legs and arms, so they're going to have to wait a lot longer. Well, what's really unique is that we have 7 programs operating across the state of Missouri. And although they have similar goals, they are very different in their operations. But the essential process is that the community mental health centers have done sort of a scan of their community to include substance use treatment disorder programs, developmental disability regional offices, food banks, churches, anyone that could offer temporary housing or basic resources, law enforcement. They worked with all of those to assess what does our community need in terms of folks who frequently visit our emergency rooms, and how can we best intervene.
We see approximately like a 68% decrease in hospitalization rates. It's in the 60s for both going back to the inpatient or going back to an ED within a 3-month time period. So it drastically reduces as soon as we get engaged, and at a very quick rate.
I didn't necessarily think that we would see such a large decrease in homelessness. You know, they're getting them connected with housing. I didn't necessarily think we would see a significant decrease in unemployment, but we are. As a result of being connected or coming into contact with this initiative, folks are getting housed. They're, because there's a lot of homeless that come through this program. They're getting housed, they're finding employment, their arrest rate is down, and certainly more are plugged into our treatment programs, which we're glad about because many of them were out there not knowing who could help them. So I think, again, it's doing the things we thought it would do, but it's doing more.
It's giving me more time with my caseworker. It's giving me transportation. It's giving me sort of like somebody to lean on, like that's not in my family, and it's kind of taking the burden off of my friends. It's helped me be more independent and to come to the table every time I have a meeting with my social worker or my case manager. I have to have things that we're gonna do for the day. It makes me more responsible. And then taking my medication, I noticed that I've been having she taught me how to set an alarm on my phone for taking my medication, and I'm able to take my medication every single day, and so I don't have emergency room. So I have emergency room time.